So good afternoon, everyone. Thank you so much for joining our PSE office hours. My name is Chen Chen, Program Associate here, also one of the PSE Program Officers. And so here is my colleague, Elbiet. Do you want to introduce yourself, Elbiet?
Sure. Good afternoon, Albia Altine Gibson. I serve as the director for the funds. Nice to see you all.
Thank you, Elbiet. So for today's meeting, we will spend some time to share about the PSE funding stream and then open for questions. I know many of you have attended the funding announcement, so just bear with us and we will probably go through some information that you already heard. So I'm gonna dive into the approach at the funding announcement. We have shared about this at a glance of a key information on the grant start date, eligible applicants, activity deadlines, etc. So we have showed that at the funding webinar this last week. So you can find the recording and the slides on our website. Here I want to mention that ineligible applicants, including current grantees and hospital for profit business and colleges, universities, are not eligible to apply as the lead applicants, but in places where they play key roles as anchor institution can participate as partners with community-based organizations at the lead applicant. Hospitals that have contributed DON funds are not eligible to receive any funding. And some of the ineligible activities, including capital expenditure and research. So for the funding, from the fund's vision and mission here, the funds are committed to disrupting and removing barriers to health, addressing structural and institutional racism, poverty, and deep power balances through community-centered policy system and environmental change approaches. We provide the resources to enhance the capacity of multi-sector collaboratives to authentically engage residents and work together so that everyone has the highest quality of life possible in Massachusetts. Community engagement plays a large role in making impactful changes in this work. We are intentional in ensuring that those most impacted are present and working hand in hand with decision makers. I'm going to show this graphic with you. So when we think about the health of this tree on this slide or the health of a community, it is important to look beyond the surface, which is the leaves and the health outcomes, for example, depression, diabetes, and injury. And we want to go deep and deep into the roots causes of the health outcomes, for example, racism, ageism, ableism, things like that. So a lot of times those deep level issues are buried under the policy system and environment people live. Therefore, those are the issues that the funds want to invest our money in to change the root causes of the health outcomes from the upper stream level policy system and environmental change. In this slide, we want to introduce you the social determinants of health. SDOH are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The graphic on the left side shows the key elements of the social determinant of health. On the right side, we are showing the DPH priority health outcomes issues, including substance use disorder, housing stability and homelessness, mental illness, mental health, chronic disease. In the past, we have received some questions. People are asking, they are focusing on early childhood education. Can they still apply? So as long as your work reflects one of those SDOH and health outcome issues, you can still apply for this grant. So for the grant award length and amount, so we will provide planning grant and full grant. Full grant is up to 200K per year, 3 to 5 years. Planning grant is up to 50K per year, 1 to 2 years. Please note that applicant cannot apply for the full grant and the planning grant at the same time. So you have to choose either one of them to apply. So for the policy system, environmental change approaches, at the funding announcement, I have mentioned that the policy system environmental change approach is a key concept across the funds. It's not just a funding stream. So we do value PSE change approach throughout the 3 funding streams. Here, we show a comparison between the programs approach versus the PSE change approach. On the left side, you can see the program approach examples, for example, like hosting a community bike ride, having an open gym night at local school, working with the corner store to become a designated healthy market, opening and maintaining a community garden. So those are more programmatic, are more short-term, and after the funding finish, you probably cannot continue those programs, events. But on the right side is the PSE change approach. For example, implementing a complete street policy to ensure community roads are designed to be safe and accessible for all users, implementing a townwide joint use agreement, enabling community members to have access to the school's gym and fields when school is not in session. Those you can see are more long-term impact, and after the funding finish, it can still continue. So we want to mention that doesn't mean that we don't value any program approaches. We still think they're important, and we think that most organizations are doing a really great job in your community, serving your community through those activities and programs. However, for this funding opportunity, we really want to focus on the right-hand side of the screen, which is the PSE change approach. We want to invest in something that will impact the communities in a long term. Here are some current awardee examples. So for our cohort 1 awardee, CHAPA, the issue here listed as stable, healthy, affordable housing is a key social determinant of health. Numerous studies have shown that where we live matters greatly to our health. The financial burden of trying to maintain an unaffordable roof over one's head often prevents individuals and families from paying for other necessities such as adequate nourishment, heat, clothing, and healthcare. Housing instability can result in emotional, behavioral, and mental health deficiencies. Those who are homeless see this health outcome expanded. The solutions that they provided: first, creation of local affordable housing coalitions. Second, increased participation of people at risk of housing instability. 3, increased participation by non-traditional stakeholders in each local housing coalition. 4, myth busting and public education through affordable housing 101 session in English and Spanish. 5, convening of all MEI supported local housing coalitions. Some of the house outcome they mentioned is housing stability, homelessness, and the root causes of the health outcome is structural, institutional racism, and racial inequality. The next example I want to show everyone is Springfield Eats. The issue they presented here is Springfield has the largest number of SNAP recipients per capita in Massachusetts, but ranks in the lowest number of HIP users. and have the highest gap in the numbers of SNAP eligible but unenrolled residents. Most SNAP recipients do not know they have a HIP benefit, or if they have, do not understand how it works or where to use it. There are not enough farmers market in Springfield and other gateway cities to meet the needs of structurally marginalized residents for fresh, culturally appropriate, healthy food. The solution that they provided here, one is increase residents' engagement by conducting a community food assessment in collaboration with partner agencies and residents. 2, increase community awareness on HIP benefit through collaborative activities and social media. 3, enroll local corner stores to increase capacity to offer HIP benefits. Support delivery of produce, equipment needed, communication supplies, and training on how to execute the program. The health outcome they mentioned here is mental illness and mental health, and root causes of health outcome is structural, institutional racism, and racial inequities. I'm gonna talk about the grant making process. So we will provide application support from January to March, and the application deadline is March 29th, and application status notification will be in June, and the award starts in July. Here is a quick slide that I want to show everyone as a comparison between PSE, CHIP, and Healthy Aging Funds. Here you can see that PSE approach is more broader. It's policy system environmental change on a local, regional, or statewide level. And priority geographic is community outside of Boston that has not historically and routinely benefited from DON dollars and have high rates of health inequities. Priority populations are the communities with high rates of health inequities. Organizations or coalitions who meet eligibility criteria can apply for this funding stream. I also mentioned about the award amount in the previous slide that planning grant is 50K, 1 to 2 years, and full is 200K every year, 3 to 5 years. Some next steps. So we will send you guys this application support calendar. We also listed this on our website. You can see that we'll provide different topics from January to February. We'll also have some open Q&A sessions for anyone who have questions related to the application portal or the RFPs. Any question that you want to ask, we have those space for you. Please visit our website to find more information. RFP, we're planning to release the RFP this week. And at the end is our email. If you have any questions, please feel free to contact us. We will try to respond as soon as we can. Okay, that's it. Anyone have